We're going to be performing thoracic CAR, which is controlled articular rotation, meaning that we're going to be concentrating specifically on this region of your spine to make sure that we put it through all ranges of motion and create more access to your tissue, okay? So what we're going to start with is we're going to put your feet wide and shoulder width apart, and we're going to grab the ground with your toes. You're going to irradiate, you're going to squeeze your thighs, hamstrings, glutes. The reason we want your feet to be a little bit wider is because we want to make sure that the hips don't rotate as your thoracic spine is going to be rotating. By putting your feet wider and really engaging the adductors, you can prevent that from happening. Okay, so the first thing we're going to do, we're going to bring the arms and we're going to cross those arms, okay? We're squeezing, we're irradiating, right? Remember, you can do this exercise at a light tension, which is like 10, 20, 30%, but if you want to increase the range, you actively have to tense up your whole body and work at about 70 to 100% of your capabilities, okay? So the first thing we're going to do, we're going to inhale, we're going to push the air down into your stomach and tense up. Then we're going to flex just in the thoracic spine and go as low as we can while keeping the lumbar lock. When we get to the position where we cannot go any further, you can see he's slightly shaking. He uses his abdominals. He's going to use his obliques to go and rotate in one direction. When he gets to the point where he cannot go anymore, because he's going to actually squeeze harder and try to go even further just with the rotation, but not allowing the hip to follow. When he cannot go any further, he's going to do flexion laterally until he gets stuck. When he gets stuck, he's going to start opening up a little bit, opening up in the thoracic spine like he is rolling a penny up his chest, trying to get as much range as he can, specifically here, and then he goes lateral flexion to the opposite side. When he cannot go any further, he's going to take that right shoulder and bring it towards his left shoulder, really rounding up together while fighting not to get range from his low back. Then he's going to bring himself forward into that spinal flexion, and then he's going to slowly come back up into the neutral position. So now, when you're rotating from side to side, you actively need to engage your obliques and make it challenging for yourself while actively squeezing the inner thighs to make sure that your hips don't follow. So we're going to reverse that. We're going to reverse that and go into the opposite direction, okay? So from here, come a little bit forward here. There you go. We're going to squeeze so you can see it. We're going to engage the core. We're going to cross. We're going to go spinal flexion as far as he can. There you go. The lumbar lock, then he rotates as much as he can into the rotates, using the obliques, just rotates. He cannot go any further. He does lateral flexion. He cannot go any further. Now he starts slowly going up, pulling those shoulder blades as far back as he can, switching from one side to the opposite side, trying not to gain too much range from his lower back, really concentrating there. Bringing this opposite shoulder and rounding up as much as he can, keeping that lock, and then finishing up, going neutral position, and slowly vertebrae by vertebrae coming back up, bringing the shoulder blades back, and relax. This exercise is quite challenging to make sure that your low back doesn't actually move. So you have to concentrate on engaging everything right here and trying to get the range specifically from your thoracic spine. So be very vigilant whenever you're performing this exercise and try not to cheat by getting extra range from your low back or rotating your pelvis.